Hi guys, hi everybody, it's me, your girl Lila Cleoda. I want to welcome you all to this channel. If you're new here, I want to welcome you. If you're returning back, I want to say thank you so much for always coming back and support me. Today I have a very exciting video, but before we do the video, I want to wish you all a happy new year and a year full of God's blessings and favor. Today, as I told you, I have a very exciting video for you. Please just take 1 minute and just subscribe to this channel, like this video, and also comment so that I can know what you want me to do next. So today I'm going to talk about the importance of working with the NHS as a healthcare assistant. I know not many people like this job because it's a very difficult job, and not many people like working in the hospital. But today I'm going to talk about 5 things that are very important if you work in the hospital as a healthcare assistant. First, I'm going to talk about, I will start this by saying when we work in the hospital, or when you hear about the hospital, first thing, not many people know much about the hospital. All we know about the hospital is about people go there when they're not feeling well, when you're admitted, when you need to go for checkups. That's what, when you hear hospital, that's what comes in your mind, and nobody wants to be there. And when you hear about the jobs, all people know about is maybe healthcare assistant, nursing, or a doctor. But the hospital has got very many departments, so many. And even if maybe in future you have never thought about a career, just going in the hospital as a HCA can open a career in your life, because there are so many departments there. And also the hospital gives you an opportunity. They offer these jobs, and they recruit people, and most people are taken as the people who work in the hospital. So you're most likely to even get a career just working in the hospital, and maybe you did not have one. So just enrolling yourself as a HCA can open a career for you in your life. And one of the careers, I'm just going to talk of very few ones, but I want to tell you there are hundreds of them. There are so many careers whereby working in a hospital can be an eye-opening for you. First, I'm going to talk about technicians. There's so many technicians when you work. Many departments they've got technicians. But I'm just going to talk about 2 departments. One of the department I'm going to talk about is pharmacy technician. As a pharmacy technician, you see those people who are, even when you go to pharmacies, you see those ladies who are working there helping the doctors. Those are pharmacy technicians. They work hand in hand with the doctors, or the pharmacist. The technician work one hand in hand with a pharmacist or a doctor. So for you to be a pharmacy technician, you have to have a diploma course in that area, whereby the NHS helps you. It gives you an opportunity. Those opportunities normally come out, and they give you opportunity. You can apply for them, and they can give you the opportunity for 2 years. The course goes for 2 years. It's a diplomacy course, and they'll give you opportunity to go and learn. They will fund for the course, and when you pass that course, they will also employ you, and you also have your diploma certificate. And not just there, if you don't want to work with them, you can also work in pharmacies and GP surgeries. Their pharmacy, you can apply, and still, if you have your diploma course, you can still get, and they can still employ if they have the vacancy. And it's a course whereby when you finish like a band 4, and the salary for a band 4 as a pharmacy technician goes to 20 to 24,000 pounds per year, which is good money for you, and that's a full career if you did not have one. Another course is ambulance technician, which also the NHS offers, and these courses are normally there. They normally put yearly or when the opportunity occurs, and you can still go do, and after you finish, you go there as a band 2 as a HCA, and when you finish like a band 4, and the salary as well is good, is 20 to 24,000. So it's a career opening. Just going there as a HCA or anything there that people may not like can just be a career opening for you. There are also so many courses. There are pathologies. There are so many courses that you can enroll with them. And when you're there, you're able to enroll, because when these job opportunities, you see them with the NHS job. I'll talk about, this is another video, I'm going to talk about it, how to apply for NHS job. So you'll be able to see these jobs, and you'll be able to apply, and you can be able to get. Another thing I'm going to talk about NHS, I'm going to talk about, if you want to do a nurse degree, as we all know, it's so hard to get into the university. First of all, if you are foreign, you're from a foreign country, because you have to do an access course in the colleges, and you have to pass the access course, which is a 2-year course or 1-year course, for you to be able to enroll in the universities. So when you're working as a HCA in the hospital, it's so easy for you to join the university without doing the access course, because all that you need, the NHS offer you some apprenticeship course which you can enroll with them, I believe, because it happens in my hospital. They offer you the apprenticeship course, which is like an NVQ that you can be able to apply the university, and you can get. And also it offers you Martin English. They have Martin English courses, which is 4 months, and after that, because most universities, they always ask if you've done Martin English level 2, and with the NHS you can be able to get that, and you can be able to enroll with the UCAS and go to the university. Not just that, the UCAS always ask for your manager's reference, which is very important when you're applying to enroll to the university. So if you're working with the NHS, you just ask your manager, and when they give you that reference, it's more easy for you to join the university. It's hard to join when you go to do access. So many people fail in the access, but when you work as a HCA, it's a more easy way to go to the university. The third thing I'm going to talk about is the NHS also sponsors people to do nursing degree. So what happens, they normally offers every year. First intake is in February, and another intake is in September. What happens with the NHS, they offer you to do the nurse career course, 4 years nursing career course, and when you finish, they will employ you. All what you need to be, if you're working with the NHS and you've worked for 6 months, you're able to apply, and you can get. So many people have used that channel, and they go to the university. And don't forget that as you're studying with the NHS, they'll also be paying you until you finish as a HCA. They'll be paying you for those 4 years as a HCA, and they'll be paying you monthly. So you don't need to look an extra job. When you're in university, if you have a family, you still need to work, and so that you can be able to maintain your family. But the NHS will give you the course, will sponsor you the degree course, and they'll also pay you. There's also another course that is the nurse associate. Nurse associate it's just, you're just like a nurse, but there are some things which you are not able to do. But it's a 2 years course, and also the salary is good. You can also apply. The NHS also offers that course, and they will pay you as you study. And after that, they will employ you, or you can work in a GP surgery, or you can work in a care home. They also recognize those kind of things. The fourth one I'm gonna talk about. I've seen so many people who have not worked in a hospital before, but they've gone straight to university, like nurse students. And when they come to work, or when they come as students they come for internship, they really face a lot of difficult, because they don't know so much. Because when you go to the university, most things they give you like a book to read for yourself. So when you come to real practical, it comes so difficult if you are not in the hospital before, or you've not worked in a hospital before. Things get so new, and so many people get discouraged. But if you worked as a HCA in a hospital, when you go to university, even when you come back to work, you're so much familiar with what you're doing. So it's so much easier to be aware of where you're gonna go as a nurse. When you go to university, it's not gonna be so difficult for you. The fifth, and not the least, I'm gonna talk about, it's when you work in a hospital, it's a good reference if you want to go work somewhere else. In case if you want to go back to a care home, so easy to get those jobs if you are coming from the hospital. Because even in the care home, with the courses the hospital have given you, they will take you, and you can even go there as a senior carer, which the money will be more. Even when you want to go back to support, you can still get yourself a good company. They will take you because you're from hospital. They really value people who come from the hospital. So with that, I'm not going to continue. I've spoken about those 5 importance of working in a hospital as a HCA, and I hope it will help somebody there who was thinking about what to do this year. You can think of coming in the hospital, and it can open so many channels for you if you had no plan for something, or you had no plan for a career. The next video I'm going to talk about how to get a HCA job with a hospital. Thank you so much for watching this video. What I will just request you, please, is don't forget to like, share, and also subscribe to this channel. Until next video, thank you so much for that.